everyone. Welcome to another episode of Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. And with me, I have my amazing co-host.
Hi, my name is Dr. Lazo, and I'm with RWJ Barnabas Health at Exchange Place, board certified in internal medicine and part of the academic practices of RWJ Barnabas Health. Now this week we have actually a very interesting segment because it's Colon Awareness Week. And we're going to have a special guest today with us to speak about all the digestive issues and specifically really what's going on at Jersey City Medical Center and all the advances. Because believe it or not, AI has actually found its way into medicine in the GI tract. And I'm dying to hear about that.
So our guest will be Dr. Etan Spira, board-certified gastroenterologist, second-generation gastroenterologist, with us today to talk about all things GI, colon health, screenings. Very excited. I think we're going to look forward to this episode. And artificial intelligence. Yeah. Who would have thought? All right. Yeah. Well, stay tuned. We'll be right back.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments. Carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
I've got cancer.
We've got the highest level of cancer care.
The latest clinical trials.
Researchers working to find a cure.
And nurse navigators to guide you every step of the way.
At New Jersey's only NCI-designated Comprehensive Cancer Center, your safety has always been our top priority.
I've got cancer, but I also have peace of mind.
Jersey City Medical Center and Rutgers Cancer Institute of New Jersey. Let's beat cancer together.
Panepinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panepintodevelopment.com. Panepinto Properties, building Jersey City for everyone.
Hi everyone and welcome back to Hudson Health. My name is Dr. Lazo and I'm with RWJ Barnabas Health at Exchange Place and I'm here with my co-host, Dr. Akunyili.
Hi everyone, Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. I'm also an emergency physician. Very excited to be here and talk about all things GI.
Yes, Colon Awareness Month.
Yes.
But it's more than just the colon in the digestive tract. So we're going to talk about everything related to that, and especially what's going on in Jersey City Medical Center, especially with the latest advances actually in GI, not just colon cancer, but colon cancer screening, et cetera, et cetera. So we're going to talk about that. We're also going to talk about a lot of the manifestations of gastroenterology. Well, why should you go see a gastroenterologist? What are some of the complaints and so on and so forth? It's a very broad scope, actually. It's one of primary care's most trusted colleagues is GI.
I would say the same for as an emergency doctor. And throughout this, we're going to put the plug that people should, when they're eligible, please go get their colonoscopies, right? Right. And as they would say, the best screening is the screening you get to do. And now, you know, about 45 people have to get screened. And that's a reminder to friends and family to do the same.
Yeah, it's really a very preventable death, to be honest with you. It's one of the few cancers that's really, caught early, you can really have a really good outcome. But again, a lot of the technology is really advancing as far as cancer screening and so on and so forth. But a lot of our patients, at least in my practice, have a lot of GI complaints. And again, it goes across the spectrum, everything from the elderly, which is likely due to their medication, to the very young, you know, who are dealing with, for example, like non-ulcerative dyspepsia, that are miserable, and they come to you, you send them to GI. So there's a lot to encompass. And again, at Jersey City Medical Center, it's not just the gastroenterology department. It's the relationship the GI has with the different disciplines. For example, like we have biliary specialists. We have colorectal specialists that work with our GI department. Our GI department even actually works with bariatrics, you know, with obesity in reference to fatty liver, and I'm sure he's going to expand on that. I'm very interested in hearing what's going on as far as the academic practices.
I am, and I think Dr. Spira, one of the things he's going to tell us is that we are so at the forefront of gastroenterology that we are actually going to be setting up a fellowship program, right? We've always talked about how important academics and training the next generation is, so we're going to do that. But what I find fascinating is like it's just a broad range, like you said. So it's not just cancers, but it's constipation, it's liver disease, it's all kinds of things under the same umbrella of experts that are really dedicated to making sure you have good digestive health.
See, now you got everybody's attention because you mentioned constipation.
Yes.
Talk about miserable.
Yes.
From primary care point of view, that is horrible for us to treat. So it's one of the main things actually from primary care, but it's actually very important because even some of the medications, I mean, in today's world, we get a lot of GLP-1 use. And
That
even
is
though
true.
they have a monster GI side effects, one of the major GI side effects actually from GLP-1 use is actually constipation.
And people don't talk enough about that.
Absolutely.
Right? Even in the emergency room, you sort of have to get that out of people because nobody wants to talk about constipation.
Well, what do you do about good GI health?
Great.
You know, this is one of the main
Great.
questions I want to ask them. What can someone
We're
do?
going to talk about all things here today.
All right, so we'll be right back. We're going to take a few moments, and we'll be right back with our special guest, Dr. Etan Spira.
Jersey City Medical Center has a passion for heart health. We're Hudson County's only full-service heart hospital with innovative technologies and premier cardiovascular physicians, a partnership with Rutgers Health, the latest technology and medical advancements, and nationally renowned care for every heart in every community. Whoever your heart beats for, our hearts beat for you. Jersey City Medical Center.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Welcome back. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a branch of RWJ Barnabas Health, and with me is my co-host.
Hi, I'm Angel Lazo, and I'm with RWJ at Exchange Place. And today we have a very special guest. We have Dr. Etan Spira.
Yes.
Dr. Spira, the floor is yours. Tell us all about gastroenterology, what you do.
All right, so I am a gastroenterologist at Jersey City Medical Center. I am a clinical assistant professor of medicine at Rutgers New Jersey Medical School and the program director of the upcoming GI Fellowship at Jersey City Medical Center. And I deal with all diseases affecting the gastrointestinal system.
We have so many questions about the GI system, but first of all, just tell us, we've been so excited to hear about this fellowship, and how long have you been with Jersey City?
So I've been with Jersey City for almost 10 years now. I've been working with fellows at Jersey City through Rutgers New Jersey Medical School, but now we are starting our own fellowship at Jersey City Medical Center. So I've been in academic medicine ever since I finished training. It's about 10 years ago, and glad to continue at Jersey City.
And so for people watching, a fellow is sort of after you do residency, then you have a fellowship in gastroenterology?
So after medical school, you would do a residency in internal medicine, and then if you want to specialize in GI, you have to do a fellowship after that.
We're very excited.
Yeah.
Welcome. So tell us, just for somebody watching this at home who's never seen a gastroenterologist, when is the right time? I'm an emergency doctor and I refer people, so does Dr. Lazo. But for somebody who's never gotten a referral or doesn't know when is the right time, what would you say?
So if you have a known GI disease, so we commonly deal with reflux, ulcers, irritable bowel syndrome, inflammatory bowel diseases such as Crohn's disease and ulcerative colitis, but also any symptoms of GI disease, so commonly nausea, vomiting, bloating, diarrhea, constipation, blood in the stool. So those are all things we deal with. And then we also deal with diseases affecting the liver. So those don't always have as many symptoms, but if you have fatty liver disease, you should come see a GI doctor, and also the pancreas.
And we also have very successful treatments, actually, even for viral hepatitis.
Yes.
That we actually do. So it's very extensive. So what are some of the things, for example, that someone could do for, let's say, bowel health? What would be your recommendation as a gastroenterologist? What can people do to help their digestive system?
So the best thing you can do is live and eat a healthy diet. Same as with most other conditions. So eating a diet high in fruits and vegetables, fiber, those will all help your GI system.
Excellent.
So do you recommend people take fiber supplements or should they just eat a healthy diet and get
So most
some?
people are fine eating just a healthy diet, but some diseases such as constipation require increasing the fiber in your diet.
Now let's talk from internal medicine, from my perspective. My main complaints from my patients is always GERD related.
Yeah.
And the biggest difficulty I have, really honestly, are the younger patients, especially with non-ulcer dyspepsia and so on and so forth. Tell us a little bit about GERD. You know, what is it? How do you diagnose it, et cetera, et cetera?
So reflux is acid that is normally supposed to be in the stomach coming up into the esophagus. And so really the only organ in the body that can deal with that degree of acid is the stomach. And so when it gets into the esophagus, it can cause symptoms, most commonly heartburn. So that's the burning sensation in your chest. But also sometimes cough or sore throat. Those are some of the other symptoms of reflux. In severe cases, it can cause damage to the esophagus, and in those cases, we often put people on medication.
You know, that's a very important distinction because a lot of individuals obviously suffer from GERD, and the symptoms can vary significantly. But what's universal is the esophagus was not meant for acid.
Right.
And that is a big deal because that you can have a transition, you know, from normal epithelium to predisposed individuals to esophageal cancer. Is that correct?
So reflux is one of the risk factors for esophageal cancer. Luckily not frequently, but it's definitely something we look for when we do endoscopies in certain people to look for some of those changes that can lead to cancer of the esophagus.
So talking about cancer, I want to talk to you about screening, right?
Yeah.
Every time there's a popular celebrity has colon cancer, someone passes away, there's some increase in the popular consciousness and then people sort of move on. But this is Colorectal Cancer Awareness Month, so I wanted to get your thoughts on GI screenings and age limits. I know some of those have changed, so please tell us about those.
So this is probably one of the most important things we do as gastroenterologists, and one of the most common things we do is screening for colon cancer. So colon cancer is one of the unique cancers in that there are tests that we can do that not only screen for colon cancer and can detect early cancer, but can actually treat it at the time of the screening. And so we can go into the different types of screening tests. I will say the most important one is the one that you get done. So the screening tests for colon cancer the most common ones are stool-based. So you submit a stool sample, and then there are different things to look for in the stool. Sometimes we look for microscopic blood in the stool. Some of the newer tests look for DNA changes in the stool. But the thing that most gastroenterologists will recommend is to get a colonoscopy for screening. So anytime any of those stool tests that you do are positive, you have to get a colonoscopy anyway. What's unique about the colonoscopy is that, again, we find early cancers or small growths called polyps, which can turn into cancer, find them, and take them out at the time of the procedure. And so currently the recommendations is for everyone, no matter who you are, to get screened starting at age 45 for regular risk people.
Yeah. And I think that changed actually recently. It went from 50 to 45. What was the impetus for that?
So while we've been doing a great job screening and the incidence of colon cancer has been decreasing, one of the areas where it has not been decreasing is in younger people. So the incidence of colon cancer in younger people has actually been increasing, those under age 55. And so the society sort of got together and decided that we need to move the screening back from 50 to 45.
What about those beer drinkers?
Yes, so there are certain habits that can lead to increased risk of cancer. And so commonly the ones are smoking, eating lots of red meat, especially processed and nitrated meats, and then also drinking. And so.
All right, this is very fascinating, but we'll have to take a break. We'll be right back.
I've got cancer.
We've got the highest level of cancer care.
The latest clinical trials.
Researchers working to find a cure.
And nurse navigators to guide you every step of the way.
At New Jersey's only NCI-designated comprehensive cancer center, your safety has always been our top priority.
I've got cancer, but I also have peace of mind.
Jersey City Medical Center and Rutgers Cancer Institute of New Jersey. Let's beat cancer together.
Panepinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panepintodevelopment.com. Panepinto Properties, building Jersey City for everyone.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Hi everyone, welcome back to Hudson Health. My name is Dr. Angel Lazo and I'm with RWJ Barnabas Health at Exchange Place. And I'm here with my colleague, Dr. Ije Akunyili.
Hi, I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. I'm also an emergency physician, and today we're here with Dr. Etan Spira, gastroenterologist with us.
Thank you.
Welcome back.
Thank you.
All right, we left off talking all things colon cancer and screening. So what are let's just take a step back. Tell us more about the symptoms of colon cancer, colon disease, and we can talk more, go back to screening questions.
Unfortunately, one of the reasons why we tell everyone to get screened no matter what at age 45 is that there aren't really any symptoms of colon cancer until it's often too advanced and too late to treat or to treat effectively. So if it is advanced, you can have blood in the stool. Sometimes you'll have a change in bowel habits where you'll notice stools are thinner. You might have weight loss, but these are often late in the course. And we want to catch it early before it gets to that stage, and we can take care of it easily.
Yeah, this is why this is one of the most preventable cancers, so to speak. And again, all it really requires is basically screening.
Yes.
So the screening starts obviously with a complaint possibly, but unfortunately for primary care and even for emergency medicine, a lot of times there aren't, like you said, there aren't really many symptoms until it's actually too late. But again, what are the modalities? Because we have different modalities for screening. And again, we used a fecal occult blood for a long time, but we've gotten very advanced with things like Cologuard and, not just screening them as far as doing colonoscopy. Right. So who would be the perfect person, for example, for a Cologuard test, screening-wise, versus, they say, just go straight for a screening colonoscopy?
We were just talking about that during the break.
Yeah. So I would say, and if you don't have symptoms, you can try one of the other screening tests. If you have symptoms, you should go straight for a colonoscopy. And then the other thing is that if you are, for some reason, don't want to go for a colonoscopy, I do them every day. I think they're very easy. I think they're, you should do one if you can, but some people have reservations about doing a colonoscopy, and that's understandable. And those people can get a stool-based test done. So the Cologuard, as you mentioned, which looks for not only blood in the stool, but also DNA changes in the stool. Right. Soon there'll probably be a blood test. How that will work is not completely clear, but that may be an option. But the important thing is that those tests only screen, and so if those are positive, you have to go for the colonoscopy.
Now, if you have a history of, say, polyp, let's say you had a previous colonoscopy and you had a history of a few polyps, would you then be eligible for a Cologuard afterwards?
So those tests are only for people who have never had any polyps. If you've had a colonoscopy and had polyps, then you should get a colonoscopy. Also, if you have a genetic predisposition to colon cancer, there are certain genetic predispositions, you should go straight for colonoscopy and probably not do a stool-based screening.
I think if there's something we leave our viewers with today is that everybody 45 and above should get tested. And if you have risk factors, let's say you had a family member die at 40 of colon cancer, when should you get tested?
So those are earlier. So if you have a family member, usually you're starting at 40, although in some cases, again, certain genetic diseases, you'll be starting earlier than that. And then if you have a family member, first-degree family member who died fairly young of colon cancer, you're doing about 10 years before their diagnosis. So sometimes that's under age 40.
And again, most colon cancer basically really comes from polyps, and there are inheritable forms of polyp, which again are those lines of cancers that are associated genetically and so on and so forth. But are most colon cancers from adenomatosis type polyps that are inhibited by aspirin? What's the link between aspirin and colon cancer? Because we talk about that all the time, and they keep going back and forth.
So aspirin probably helps prevent colon cancer, but not to the degree that we would recommend it unless you have another reason to be on it. So if you have a cardiac disease and you should be on aspirin, then you should take aspirin. But because there are side effects with taking aspirin all the time, while it does probably prevent it to some degree, it's not something that we recommend you doing to prevent colon cancer.
So I know we talked at the beginning of this about advances in artificial intelligence in gastroenterology. Just before we close, do you want to tell us 30 seconds about what's going on?
Yeah, so AI is everywhere.
Yes.
And it has gone into the field of GI. So when we do a colonoscopy, it's a tube with a camera on the end of it. We're looking for those small growths. And so as we're doing the procedure, we're looking at a screen. And now we have the benefit of AI, which has been sort of taught to help us identify those polyps. Even small polyps or difficult to detect polyps, it'll pop up on the screen that maybe this is somewhere you should be looking. And so it helps us find those polyps and prevent more cancers.
That is fascinating. Who would have thought?
And you also use, I guess, ultrasound and so on and so forth, and then endoscopic ultrasound?
Yeah, so oftentimes for procedures, advanced endoscopists can use endoscopic ultrasound, which is instead of a camera on the end of it, it's an ultrasound probe, and we can look through walls in the intestines or stomach and look into other organs and find things that, that we want to get a piece of or for certain reasons.
It was a pleasure having you, Dr. Spira.
Such a pleasure. We could have you here all day.
Yes, absolutely.
I'm sorry.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design studio and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Hi everyone and welcome back to Hudson Health. My name is Dr. Angel Lazo. I'm with RWJ Barnabas Health at Exchange Place, and I'm here with my co-host, Dr. Akunyili.
Hello, my name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, facility of RWJ Barnabas Health. And that was a wonderful segment with Dr. Spira. I thought it was we could have been there all day, right?
Yeah, we're definitely going to have him back, without a doubt.
I think, it's just, I'm fascinated at broad spectrum, and we see that. I'm an emergency physician. I see all kinds of gastroenterological illnesses, and we go in and refer them after the visit. But it's just the scope of what GI docs do, and also the ability to prevent a lot of preventative work, which we're both passionate about. But then you have to get screenings for that.
You mentioned the scope. And it's
Oh,
incredible
gosh,
nowadays,
no
even in
pun
GI, they
intended.
have AI. I mean, it's just unbelievable
Yes.
how the technology just infiltrates its way to patient care, which is very exciting. And again, that's probably a big part of the academic practices at RWJ Barnabas Health. But it's such an advantage. I mean, this is Colon Cancer Awareness Month.
Yep.
And the take-home message here is, do not wait to have a symptom or a sign, especially when it comes to colon cancer screening. I mean, it's very simple to do. We have different modalities, speak to your doctor. This is such of a preventable cancer. And again, there's a lot that you can do with your diet and so on and so forth, but it's just a wonderful experience speaking to Dr. Spira.
And to echo Dr. Spira's point, the best screening test is the one you get.
Yeah.
Right? So while for many people colonoscopy is recommended, it's better to have a screening test than none. Yeah. And I know there's still a lot of hesitation in different sectors of our society. So maybe this breaks down some of those barriers.
I hope so. But again, we deal a lot with a lot of digestive issues, and especially now in today's world, with some of the treatments for diabetes, with like Ozempic and the Mounjaros, the so-called GLP-1 class, which has such a broad spectrum of GI complaints, especially constipation, for example, which is a real headache in our practice.
Yeah, absolutely. That's not comfortable. But I liked what he said about sort of the best thing you can do for your digestive health is a healthy diet. We've talked about that multiple times. So water, fruits, vegetables. So also preaching sort of those basic tenets of prevention.
Yeah. It's like my mother used to say, you are what you eat.
That is true. That is true.
Very true. But I'm very happy, especially with a lot of the advances actually that Jersey City Medical Center has. Endoscopic endoscopy. Now we have AI. I mean, we really offer our community a broad array of not just screening tools, but specialists. I mean, we have the full gamut as far as the gastroenterology world, including even surgeons that specialize in hepatobiliary disease and so on and so forth. So we cover the whole gamut. And again, GI's relationship with bariatrics is very close. And even GI's relationship with cardiology, with fatty liver, believe it or not.
That's true. Well, talking
close.
about bariatrics, stay tuned because we have a very big bariatric surgery program starting. It was wonderful to have this segment. Please get your colonoscopies or get your colon cancer screenings. Again, my name is Dr. Ije Akunyili. Thanks for watching.
And my name is Dr. Angel Lazo, and we will see you next week.